Starting tomorrow, any veteran who finds themselves facing a mental health crisis can go to the VA or any private facility for free. This move has the potential to impact 18 million veterans across the U.S.
It's an effort by the government to reduce the high number of suicides that have plagued the military community for years. Christian Garzone spoke with local leaders about how the new policy will work. Christian.
Well, Adam, Teresa, we still lose about 16 veterans a day to suicide in the U.S. The government is hoping this move can knock down barriers to mental health care and save the lives of those struggling after service. Nick Stefanovic, the director of Monroe County Veteran Services, says for a veteran in a mental health crisis, this is how it currently works.
You can go to a VA and they will start the process of treating you and then quickly get you referred out to either private pay or something you might have insurance to cover.
Tuesday, that all changes. Any veteran in the VA system or not can get extended mental health treatment for free.
If there's not a VA close by, they can engage with private practice mental health or other hospitals.
He says to keep another major detail in mind.
Conception out there with many people is that all veterans get VA health care. In fact, most veterans don't get VA health care.
Assemblyman Brian Mangtalo on the Veterans Committee says there are about 9 million veterans registered with the VA and about 9 million who are not.
It's huge because I've seen what veteran suicide have done to our veterans, especially when they get home.
He says for suicide prevention, this could be a key step.
Well, now that they have the ability to go someplace quicker and sooner.
This move will offer veterans 30 days of inpatient care and 90 days of follow-up care and will reimburse them for ambulance rides. It also includes veterans needing help with substance abuse. But Stefanovic says if you use this and want to avoid the bill, do this.
Understand that, but veterans need to contact VA immediately upon using a service that they want VA to pay for.
Now, it's not clear yet how a veteran will prove service to a medical provider, likely with a DD-214. More details will come out this week. Adam, Teresa, back to you.
All right, Christian, thank you. Veterans experiencing a mental health emergency can contact the Veterans Crisis Line through 988, or they can call 1-800-273-8255. We will have more information with this story on the web at rochesterfirst.com.